What is happening with health plans? This is one of the most complicated questions, I think, to answer. And it is one where I'm so glad that we have incredible journalists working on it. And so today, I'm really excited to welcome Peter from Financial Times, who has been covering health plans and the health insurance and payer space for many years now, to be with us on Remaking Medicine and to talk about just what is happening in this very big, very impactful, and often very secretive, or at least very private sector. So, Peter, welcome. Thank you so much for being here with us today.
Thanks, Emily. Nice to be here. Thanks for having me. And yeah, happy to be here and to jump into it.
And so, both of us got our start in local newspapers, right?
Yeah,
I
yeah,
was
yeah,
at the Sacramento Bee way back in the day. You started out on the local beat doing infrastructure, and that's a pretty straightforward beat, right? Or
yeah.
is there also a lot of like secrecy and
Oh,
trying to
there. I
uncover
mean,
things there?
depends on like who you're dealing with, right? Like I can think of a few couple um public officials and bureaucrats who are quite close to the best. But yeah, outside of sort of petty fiefdoms, it's all stuff that's governed by like public records, transparency laws and stuff like that. But yeah, nothing. There's nothing quite like health plans as far as
Yeah.
opacity. Yeah.
Covering health plans seems like a really tough beat. Do you think that stigma might be correct, right? Is it hard to get good information on what is happening in this space?
Yes, it is. It's very difficult because these companies they have a very sort of defensive posture for the most part. I think,
Mm.
especially the for-profit companies. There's like a diversity of health plan types. There's a lot of nonprofits in the
Hmm.
space. Some of the very biggest health insurance companies are not for profit. Kaiser Permanente, Healthcare Service Corporation, which is the biggest Blue Cross and Blue Shield nonprofit company. They're some of the biggest companies in the country, but
Hmm.
they're nonprofits, and they tend to be a little more approachable because they perceive themselves and in some ways do act in a more mission-driven way
Hmm.
than their for-profit peers. The for-profits, of course, are United Health, Cigna, Aetna, which is owned by CVS. Those companies, they're huge and they tend to be pretty defensive. My colleagues and I always joke about, we reach out to comment to these companies all the time, pretty much whenever we write a story about them. We want them to give them the opportunity to weigh in on
Hmm.
whatever we're writing about. And some of them are better than others. CVS is actually pretty responsive. But we always joke that whenever we hear from Elevance, which is the owner of Anthem, it's like a big deal. We send each other slacks, we talk about it, we joke
Like
about
ring the
it. They're like,
bell.
wow, they actually answered. Which it's only like 1 out of 20 times that they
Yeah.
actually say anything to us. So,
Yeah.
yeah.
And it must make your job challenging because you're trying to tell an accurate and balanced story about what health plans are doing. And, um, it's hard to get that inside perspective often from them, right? And so do you feel
Yes.
like the reporting tends to, they're just not participating sometimes. And so those stories get away from them. They're not really telling their own side of the story.
Yeah, I think that's right. And a lot of what we have to do instead is talk to people in and or around the companies on
Hmm.
background, which is not what I prefer to do as a reporter. Like I want people to know who I'm talking to and
Hmm.
um, what their role is in any given story, because that makes it easier for the reader to identify their motivations, their agenda,
Hmm.
their
Hmm.
incentives. But because of that reliance on background sources, it does tend to be a lot of people who um, are unhappy about what's going on, whatever thing.
Hmm.
And that then necessarily leads us to write a story that includes a lot more critique and I guess not the narratives that these companies want, right?
Yeah.
Because we can't get them to talk about their official statement in any detail. And I think some of that is like, any public company, um, they don't want to talk about stuff on the record that's going to affect their
Mhm.
stock price. But this is, a lot of what we want them to do is just put us on the phone with someone for a few minutes who knows what's going on with a given issue
Yeah.
and talk about it in more detail. And that's something that other public companies do in other industries. They may say, I can't talk about that, but they will answer the phone. They will say what they can. And
Yeah.
I think it's really not helpful for these companies' reputations.
Let's talk about the reputation, right? Because they have sort of a reputation of being the bad guys right
Hmm.
now in healthcare. And do you think that's deserved, undeserved, a mix of both?
Yes. Yeah, great question. I think there's plenty of blame to go around in the US healthcare system. It
Mm,
is, um, as you talk about it all the time with people all across it. There's so many things about it that are broken and dysfunctional. Um, I would say that health insurance, most of all, is um, the things that are broken about it are a product of it kind of happening rather than being designed.
mm,
Health insurance in the United States um, became an industry starting in the 30s and 40s, and especially during World War II, when companies wages were frozen during the war, and to hire people, companies started to offer health plans as a way to attract and retain workers, and
mm,
that then started the health insurance industry as we know it, and a series of reforms of one piece or that piece or another piece came into place
mm,
over time, and we have this broken, like a torn quilt, you could say, like a quilt that
mm,
like didn't get finished in a lot of places.
mm,
And health insurance companies are responsible for a lot of stuff that they don't have control over. They pay for things that they can't really say no to, as much
mm.
as they try. Prior authorization is, of course, everyone's most hated things about health insurance,
Yeah.
and rightly so. But all that is to say, health insurance companies don't have a lot of agency, um, and they're responsible for, they are middlemen, they're intermediaries, and
Yeah.
they don't have a lot of control over what's going on. Um, that said, they don't help themselves because, as we just said, they don't talk to anyone, and they also have practices like prior authorization that um, piss everyone off.
Yeah. Yeah.
Providers hate it, patients hate it, and it doesn't actually really work as far as anyone can tell. So, it's um, there's a lot to say about cost containment and pricing and stuff, and
Mhm.
there's limits to what health plans can actually do.
Mhm.
But I would say they're not the only ones who are responsible for how messed up stuff is at the moment.
Yeah. We just had health economist Dr. Ho on our show, and she was talking about showing charts. She came with charts to our conversation, receipts.
Nice. Yeah.
That when we talk about the increasing cost of healthcare, it's really coming from the hospitals and the big, hospital conglomerates and big health systems. And health plans are just kind of hitch their wagon to that system. They're not able to necessarily control those costs. And, yet I think public reputation wise, hospitals do not get the blowback that health plans do. Right. And, yeah, like, are there any health plans that you think are fighting back in a more effective way or are trying to tell that story in a different way? Are you seeing some signs of life out there in the market, or they're just letting it kind of the story play out the way it is?
Yeah. I think it depends really on the company
Mm,
and the region too. Healthcare, we tend to talk about in sort of a national way from a policy perspective, but states have a lot of authority,
mm,
especially with hospitals, and it can vary quite significantly from place to place. And that also has to do with consolidation and the structure of various markets. But
mhm,
um, I think there are some companies that have a different approach. actually, I should back up before I get into that. The big thing in health insurance, as far as cost containment, is value-based care.
Hmm.
Um, what it is, I don't know that anyone can actually say, right?
It's a concept of a plan. There's some
Right.
parts of it that are a little bit more fully baked now. I mean, we're 10 years in maybe on value-based care,
Right,
right?
right. And I think, there are a lot of things that could fit into the category.
Mm,
Um, and they're pretty different. But everyone in the health insurance industry is ostensibly pursuing that. Um, and I think for the insurance companies, they would genuinely like some sort of risk-based mechanism because I think it's an opportunity for them to exercise more control over their cash flow and probably make
mhm,
more. But their ability to actually do so is limited.
mm,
Um, so there's sort of a spectrum. Uh, there's insurance companies that own providers. Kaiser Permanente obviously is the clearest example of that,
mhm,
and they are sort of the progenitors of value-based care in the United States. And then there's sort of a spectrum moving on from there. There's Optum, which is owned by United Healthcare. It's the largest employer of physicians in the United States.
mm.
And well, there's a lot going on at Optum. That's a whole other conversation. But they are ostensibly doing some value-based care. And then other payer-owned providers as well. Humana has a lot of providers. And all the payers have tried to purchase provider groups in lucrative specialties over the last 5, 10 years. They're starting to actually pull back from that because they realize it's really hard to integrate with the health plan,
Mm, mhm,
especially as sort of um, there that would essentially require them to run two business models, to run a mini Kaiser in one part, and
mm,
then the other 80% of the company would be business as
mhm.
usual. And that just hasn't worked very well. So essentially what providers are still owned by payers are starting to focus again on fee for service, and are
Okay.
not trying to necessarily do this sort of synergistic value creation that they were
Mhm.
supposed to do. Um, I sort of lost track of the original question.
No, that was good. I'm enjoying the journey we're
Yeah, yeah,
on
yeah,
together.
yeah.
Yeah, I mean, I think that's the
Oh, we were talking
like,
about hospitals though, right? Like sort of their
mhm,
responsibility.
mhm,
Um, I mentioned consolidation earlier. I think
mhm,
that is really, if we want to point at one specific issue,
mhm,
that is making healthcare costs go up really fast,
mhm,
I think that's sort of the underlying issue. Um,
mhm,
most metro areas in the United States have a duopoly of hospitals, and they're now starting to buy up all the specialists as well,
mhm,
and a lot of primary care.
mhm,
And that means that they have duopoly pricing power and are able to, um, you know, set prices by fiat, essentially. And that
mhm,
means that health plans have to raise prices every year. Um, when there's only two hospitals, or two groups of hospitals, I should say, it really limits a plan's ability to sort of do any sort of
mhm,
bidding and price competition to
mhm.
manage plan design in that sort of way.
And part of the complexity here is, I mean, who would you say is actually the health plan's customer, right?
Great question. That is such a good question. And I think it's something that people don't think about enough.
Yeah.
The biggest customer of health plans is actually private employers.
Hmm.
Unless, uh, you know, so yeah, two big customers really, private employers and governments.
Hmm.
Um, Most people in the United States get covered by a commercial plan, and commercial plans, about 80% of your typical commercial plan premium is paid by a company.
Hmm.
Um, so yeah, big companies are their customers. Um, and then there are government-backed insurance plans, primarily Medicare, Medicaid, and the Affordable Care Act,
Hmm.
but also employee plans paid for by the federal government and state and local governments. Um, so yeah, the biggest customers of health
Yeah.
plans are other institutions of similar size.
And those customers are happy.
Oh no, they're
No,
furious.
no, they're
They're
furious.
pissed.
They're
Oh, they're
really,
so
really
mad.
angry.
Yeah, absolutely. I talk a fair amount to people in the employer insurance space,
Uh-huh.
and um, there is you asked me about, cost containment and uh the ability of plans to kind of exercise some power over pricing and
Mm-hmm.
cost. Um, I think they are leaving some on the table as much as, yes,
Mm.
hospitals and providers have a lot of responsibility as well. But
Mm-hmm.
um, commercial plan sponsors, that is the companies that pay for commercial plans for their employees, they're very unhappy with the amount of service and cost
Mm.
containment effort that they're getting from the health insurance companies.
Mm-hmm.
Um, they're really frustrated with a lack of information about quality, um, and are especially frustrated by specialty drug costs and PBM games, which is a whole additional conversation of opacity. But yeah, I
Mm-hmm.
would say yes, they're very frustrated for the most part.
Yeah. But they don't have a choice of where to go. Is that like, I mean, it's just such we all know, of course, like nothing in the law of physics like applies accurately in healthcare, right? Or like the
Hmm.
normal laws of business and economics. But I mean, wouldn't you think if those employers are so unhappy that they would try to leave, go somewhere else?
Yes, and so I actually spoke at the end of last year at an employer purchaser conference, and made this point. A lot of big employers don't bid out their contracts
Mm.
um, for health benefits,
Hmm.
and there are a lot of reasons for that. It's really expensive to do,
Hmm.
um, primarily, and it can also be really disruptive for the people that work for the company in question,
Hmm.
especially the people who are dealing with really complex or high acuity cases. Think of a child with a rare disease, someone who's been diagnosed with cancer. Those people can be really, really negatively affected by a change in carriers because networks change. They may or may not be able to keep a provider they've been working with for years and that they trust.
Hmm.
And those are the people who are going to be the most motivated to talk to the company and say that their lives are being upended and their loved
Hmm.
ones are being harmed. So there's a genuine sort of human costs to changing health plans that I
Hmm.
think can be easy to lose track of when we're sort of talking about it in this economic level. But then there's also just sort of more straightforward corporate concerns. It's typical for even the biggest company to just have a handful of people administering all benefits. So it's not just the health plan, although that's their biggest thing. It's also dental, the life insurance policy, working with whatever 401k provider, et cetera, et cetera. And they're doing hiring and all that stuff.
Hmm.
Um, and they often lack the bandwidth and expertise to be able to
Mm,
parse what these bids contain, if they even do get to that point. Um, and it's also something that the C-suite doesn't really want to deal with. They want to
mhm,
run the business. They're focused on value creation. They're focused on growth, et cetera. And they don't want to spend extra money on top of their
mm,
what is often their number one or number two expense every year.
mhm,
Um, so
mm,
there's a lot of inertia inside these companies to changing health plans, and it's very difficult. That said, when companies do change plans, they're often surprised about how much money they can save. And
mm,
now I'm starting to sound like
mhm.
a Geico commercial again, an insurance company. But
Yeah.
it's a
Yeah.
great question, and I think it's
Yeah.
something that people overlook.
No, I mean, it is fascinating from a corporate sense of like a company, like Starbucks, right, might have
Right.
10,000 people working on the supply chain of the beans, right? And like getting the coffee to where it needs to go and the
Yeah.
operations of that.
And hundreds of retail stores, right?
Yeah.
So
And
many
they might
people. Yeah.
have 100 people on benefits. I mean, to
Right.
be like, that's probably generous, right? But they spend more on healthcare than they spend on beans, right, in the business. And
Right.
it's just sort of organically grown into this massive cost. Is it like a boil the frog kind of situation where maybe we haven't hit that tipping point yet, where employers see that this is something they really need to take more seriously?
Yes, I think that's exactly right. And I think a really interesting place is, these giant employers, they have the most agency, they have
Hmm.
real purchasing power and can um, drive a certain amount of competition in the marketplace when they do put out a bid. When they bid out their business, they're going to get um, probably at least one blue affiliate, multiple nationals.
Hmm.
Um, and have some options to choose from. There's more of a middle market that's
Mm.
really getting squeezed in a way that you're talking about. There's sort of a boiling frog thing going on for the really big companies, especially because they're across multiple markets, multiple states,
Hmm.
right? But for a company that's even quite a large employer, like 1,000 to 5,000 people, if they're all in the same place, they don't have as much agency, and they
Mm-hmm.
probably have even less sophistication than that group of, five HR managers that we were talking about
Hmm.
a minute
Hmm.
ago. Um, and what we're seeing with those companies is a lot of interest in new benefit designs and new risk arrangements. Um, because they really just can't afford it anymore.
Mm-hmm.
Typically, I don't have the exact numbers in front of me, but annual year-over-year cost growth in commercial insurance, employer-sponsored insurance, has been around 10% for this entire decade. Um,
Yeah.
and it's just not sustainable. That's
Yeah.
a compounded number.
Yeah.
Yeah, there's a lot of frustration. I think there's coming disruption that may not be fully here yet.
Well, I was going to ask you more questions about that process, but if you're going to tease coming disruption,
Yeah,
tell us
yeah,
more
yeah,
about
yeah.
that.
Yeah. So you'll have to forgive me for some, kind of wonkery here, but essentially, how it works with employer-backed health insurance is the company takes on all the risk.
Mm.
They are, in effect, their own insurer.
Hmm.
Um, and there's different ways to do that underwriting and distribute that risk that some companies do. But for the most part, companies pay for everything.
Hmm.
Um, that's one of the reasons they're frustrated with health plans because the health plan doesn't have really any incentive to do anything but raise prices every year, right?
Uh-huh.
But for this middle market company, they're reaching the point where, you know, uh, a few high cost claims can blow their P&L for a quarter.
Mm.
And they don't want to be their own insurance company. That's not what they do. They,
Mm.
run a store, they run a factory, they make software, whatever it
Mm.
is. They want to run their business and they don't want their results to be affected by this sort of stuff. And
Mm.
they're demanding that the health insurance companies take on more risk and actually
Mm.
do the job of managing the risk that they have not been required to. And we've already seen Cigna, which is one of the biggest, if not the biggest, carrier for companies of this size. Um, they lost money on this specific category um, for all of, I think, 2024 and
Hmm.
spent all of 2025 trying to fix it.
Mm.
Um, and I think that's only going to become more common across other commercial insurance companies. Health plans, as we said before, don't have a lot of control over how
Uh-huh.
much stuff costs. Um, but they also are really bad at managing risk at the same time. So, it's something that's going to have to give one way or another.
What kind of things did they do in 2025 to try to, you said to correct that loss that
Raise
they had?
prices. Prices went up.
No. Oh, I thought it was going to be like, oh, they were investing in primary care and they
Oh
were
no.
like,
Oh no, nothing like that.
okay. So, yeah. I think that is a frustration I hear from people who work inside of health plans, right? Is that they do sit in potentially a very powerful position, but that they're very risk averse, right?
Hmm.
Which is, I mean, that seems like part of the cultural DNA of a health of any insurance company is to be risk averse. Like that's
Yes,
like,
as it should be, right?
yeah,
Like that's the whole
like
idea.
you're not
Yeah,
here to
for
take
sure.
risks. um, but it does seem like, and there's almost like an identity crisis, I think, in some of these health plans of wanting to be, in some ways just very conservative, very buttoned up, very risk averse, straight down the line. And then trying to sometimes be, the good guy who has the wellness apps and the, kind of innovative tools. And maybe, I'm thinking of Blue Cross, Blue Shield here in California, which has tried to be, I think, genuinely a little bit better in terms of like, let's lead interoperability in the state. Like, let's really try to create some systems. But, there's always that tension of like, who really wants that innovation, right? How do they sell that to that customer? Like,
Hmm.
how does that actually impact their bottom line? I think it's like an identity crisis a lot for these companies. And do you agree with that?
Yeah, I think that's right. And I also
Mm,
think it's you asked who the customer of a health plan is. I
mm,
think they kind of misunderstand their own customers.
mm,
And uh, there's a lot of mediation even between an employer who's buying a health plan and the the insurance company themselves. They work with brokers typically.
mm, mm,
Um, and I think that the typical business owner, the typical C-suite even, doesn't understand this stuff.
mm,
And like I said, wants to run their business. So
mm.
they will stick with the company that they already know, the devil you know, and avoid this nasty headache as much as they
It's just
can.
a cost of doing business. Everyone,
Exactly.
the company, my competitor is going to pay the same amount as me. It's not worth it to go out and try to take this on, kind of energy.
Exactly.
Mm,
Exactly. And
mm-hmm,
I think I don't know what plans could do necessarily. I think it may come back to what we started this conversation with, which is, embracing more openness and more transparency.
mm-hmm.
I know that they spend a lot of money on marketing, but I don't think that anyone that matters, right? Like,
It's a lot of like stadium naming,
I was just gonna
right?
say,
It's
like,
not, I would
yeah,
say I would
yeah,
put it in the category of advertising and not
right.
really truly marketing,
Yeah,
right?
that's right. That's absolutely right. Yeah, like you see
Yeah,
like the ad for your Blue Cross company in your state
yeah,
whenever you watch a baseball or basketball game,
yeah.
right? And same thing for a hospital system too, right? But you're like, all right, I know you exist. Like, I don't, this isn't telling
Right,
me a story, right?
right.
Yeah,
And then I think that, I mean, let's talk also about the sort of shadow customer, which is the shareholder, right? And,
yeah, yeah.
for these public companies, it it feels to me that they actually, the shareholder is a much more important customer to them than actually the employer. Is that unfair? Is that a mean thing
No,
to say?
I think that's right on the
Okay.
money.
'Cause
I
I
think
think
it's
we thought
exactly right.
like United, right,
Hmm.
had a downturn where they didn't profit as much in a couple quarters, and the shareholders were very mad.
They
And that
lost
actually might have
50%
been,
of their market cap last year.
yeah, right.
It may
That
have come
actually
back
might
up
have
a
been
bit,
something
but
that the
yeah,
employee, like if you think of the employer as a customer, that might not have actually been disruptive to the employer potentially.
yeah.
But to the shareholder, that was incredibly disruptive and it
Mhm.
merited incredible change in the organization to get those profits back up. So, yeah, tell me about that relationship.
Yeah, absolutely. Well, I think it plays out in a lot of ways, but I think one of the most important parts for what you asked specifically is like thinking about the customer and about um, uh, a business purchaser is that these companies, the nationals, are increasingly not making a lot of money from their health insurance arm.
Mm,
Um, as far as revenue, it's still a huge part of it. United Healthcare, which is United Health Group's health insurance arm, accounts for somewhere in the neighborhood of 50% of revenue,
mm,
but it does not account for a majority of margins.
mm,
Most of the profit comes from the PBM, Optum RX and from Optum, which has a whole bunch of
Mm-hmm.
stuff, but is mostly healthcare providers. The
Mm-hmm.
same is true for Cigna as well, Evernorth, their services and PBM division often accounts for a lot of their margin. And the other nationals are increasingly going that way as well.
Mm-hmm.
Um, so yeah, the health plan is really not a focus anymore. I think these companies are
Mm-hmm.
so big and so diversified that um, the leadership doesn't always focus, especially since, as we mentioned before, people just renew every year. So
Mm-hmm.
why should
Mm-hmm.
they focus, right?
Oh, so my Silicon Valley brain looks at this like kind of deadlocked, massive, lucrative sometimes sector,
Very lucrative. I
very
mean,
lucrative
yeah,
sector.
I think
And
Cigna's
yeah,
made 8.5 billion in
okay,
pure
yeah. So
profit last year.
extremely, we'll say extremely lucrative, right?
Yeah,
And like this feels like a ripe for disruption sector, right? This looks to me like if you go back to banking in the 1980s and 90s and you're like, whoa, like you have these massive giant old companies and and like this seems like a thing where somebody new could come into this market and like disrupt, right? This is the Silicon Valley way. But we've seen very little of that. Why aren't there more people out there trying to get into this business? Like, is it just too hard? And then, like thinking about Oscar, for example, which now almost 15 years old, Oscar.
crazy. I know. I still think of them as brand new, right?
Right? The new kid on the block,
Yeah, yeah.
has like a learner's permit for his car now.
They grow up
Why
so
do you
fast.
think new entrants can't get into this market?
Yeah, yeah. I think a lot of the things you just mentioned,
Mhm.
complexity. It's hard to think of a more complex industry in the United States, and that's not for any good reason.
Mhm.
I mean, providing healthcare is a complicated and delicate matter anywhere in the
Mhm.
world, but we just
Mhm.
have so many layers of layers of middlemen and
Mhm.
and nonsense. And so I think that's the biggest reason. It's also really capital intensive
Mhm.
to stand up a health plan, even a regional health plan. We're talking about potentially billions in premiums.
Mhm.
If you think about Blue Cross and Blue Shield affiliates, um, a lot of the time they're the biggest, one of the biggest companies in their state by revenue. Um, so that those two things I
Mhm.
think really make incumbency um, quite quite hard to disrupt.
Hmm. And then how about, I mean, even an incumbent, somebody breaking away and being like,
Mhm.
okay, I'm going to go against the tides. The only one that could stand out to me, and Blue Shield of California, I think has tried in some ways to be that person, Rocky. And then like Scan Health Plan in like
Mhm.
Arizona, like SoCal, at least from like a marketing perspective, has really tried to have like, they have like a bright yellow,
Yeah, yeah.
like bold
I was
statement.
actually
Yeah.
talking with Dr. Jane, their CEO, last week.
Yeah. Yeah.
He's great. They and as far as what we talked about with transparency, they are very available. They're very open to the
Okay. So he
press
answers
and
the phone.
are out
Yeah.
there. Yeah, he answers the phone. Um, I have talked to other health plan CEOs, but rarely on the record. And
hmm
yeah, I think there is definitely a lot of interest in some of the big California carriers and trying stuff
hmm
out. Kaiser also is charting this very bold expansion
I mean,
plan
Kaiser, I
with
put in its own. I mean,
it. I know
Kaiser
it
is
is its
like
own
living
like
on a
sort of
different planet.
weird
I'm a Kaiser
thing.
member. It's very
Yeah,
different.
yeah. Um, but yeah, no, I think you're right to call out Blue
Yeah.
Shield and Scan. They're both definitely they're both trying stuff, and
hmm
I think that's to their credit.
hmm
Um, and yeah, that's really not common other places.
hmm
Some of that is, you know, uh, this is the point where we talk about AI, I think,
hmm hmm
which is definitely. going to change things, which things it's going to change, how fast, to what degree,
Yeah.
depends who you talk to, right? But there is already what I've heard described as an arms race in sort of billing and claims
Yeah.
between providers and insurers. And the ability of these companies to keep up with that and innovate in
Yeah.
that space, yeah, I don't know. We'll see. Well, I think some of that's
Yeah.
strategic, and
It does
some of
seem
it,
like a place. I mean, if you're
yeah,
a company with just a massive amount of data beyond the point that it's human processable,
right.
and that data controls a ton of spend, that feels like a pretty great use case for
It
AI,
is. It is. There's so
right?
much information that they just can't use
Yeah.
now, right?
Yeah.
And there's this, digital transformation that we've been talking about in healthcare for years
Hmm.
and years, right?
Hmm.
Um, and AI potentially has the opportunity to use some of this
Yeah.
price transparency and
Right.
interoperability data in a useful way. Um,
And then
yeah.
it just, I mean, to be the comms person in the room, the marketing person though, is like to make that AI transformation work, you have to have a lot of trust with the people around you to say,
Hmm.
right, for like our AI told us that we should pay you twice as much as we pay somebody else, or we should cut your payments, right? Or we shouldn't cover this. Like nobody will take that unless you have, I mean, to me, right? Like you have some kind of trust relationship with people.
Yeah,
And so
absolutely.
the reputation piece and the way that the health plans have just decided that's not for them, like that just feels like a massive business risk to me.
Yeah, absolutely. Well, and I think, we talked about value-based care and like,
Hmm.
is it real? Right. I think this is actually the way to, if not to do some sort of risk-based reimbursement, which is certainly compelling. I think it's really hard to do.
Yeah,
But I think to your point about building trust and building relationships, if um, a payer is able to find value and find quality
yeah,
embedded in the claims that they haven't unearthed before,
yeah,
then maybe it's about sort of calling in that provider and doing as much as you can to send your people there, and not taking this sort of passive approach where, I
yeah,
think providers kind of just get paid whatever and don't know how much is going to come. But
yeah,
actually having someone, one person who they could talk to all the time,
yeah,
who's like, a partner and a
yeah,
colleague, I don't know how many plans are doing that. And also paying more money for good
yeah.
stuff.
I
And some
mean,
of
I
that is like,
think,
it's
yeah,
just hard to tell who is doing a good job, right? And
yeah,
even people who might be doing a good job might not get good results based
yeah,
on the profile of their patients.
yeah.
So yeah, it's really tough. It's really tough.
I mean, I feel like this is such a crossroads moment for technology in healthcare, and a crossroads that I think we didn't get right back in 2009 around the electronic health records. And,
Hmm.
we spent a lot of decades here just like kind of struggling to get technology integrated into healthcare in a way that really makes sense, like operational technology. And I just so clearly see like that there's two possible ways that this could go. Is one, the health plans continue doing business as usual, but now with like more paperwork, more AI, more like black box, that's just what it is kind of attitude of like, well, you just got denied because the AI said that you're denied now, and like not having a good relationship with people. I could see AI making the relationship so much worse. But I also see that there's a potential, like they could be doing so much more with transparency, like getting reimbursements, like even just speeding up that process would be so massive. I mean, how is
Oh man, so huge. Like if
yeah,
you talk
I
to
mean, just from
providers,
like
it's
a
like
pure
their
like management
biggest,
perspective, like how
yeah,
am I supposed to adjust my behavior and then wait 6 months to know if that worked or not, and then try to remember what I was doing 6 months
right,
ago?
right. Well, and I think to that point, it's payers often forget that they're not the only payer that providers deal
Mm,
with.
yeah,
Every provider is
yeah,
dealing with four, five, six different insurance companies on a
yeah.
different day. Um, Maybe even more than that,
Yeah.
And so it's
Yeah.
it's like, and they all have different portals. They all have different standards of documentation. We're not
Yeah.
standards necessarily, but they prefer
Yeah.
things and dislike different things, and
Yeah.
no one's going to, write up encounter notes, um, and think about, if they are thinking about coding,
Yep.
they're thinking about what is that code? They're not
Yeah.
thinking about,
Yeah.
does Cigna like it, but United Health not like it, you know?
There is a moment. This is a portal to all of our health plan people who are listening to this conversation. I just would say, like, there is a portal opening right now that if you stepped through and you said, I want to become a good guy, right? Reputation wise, like there's so much potential energy in this moment to step through that portal and to say, just honestly, like, hey, we're going to turn things around. We want you to like us. We want to be a good partner in the system. We still can make tons of money doing it, but like we just, we could change and like really change the way that we're situated in this market. And my my hope is that somebody, at least a couple people, step through that portal. I think a lot of people won't, and it'll just be interesting to see what happens, right? It's hard.
Absolutely.
It's hard to go through that portal. Well, we're almost done with our time here. So, at the end of the conversation, health plans, optimist, pessimist, like how do you feel like it's going to get, like when we talk 5 years from now? You're going to look back and be like, oh, that's cute that I thought things were not going to change or that I thought things would
Yeah,
change.
yeah. Well, I would say, they're in for a hard time in the
Okay.
next few years. The commercial insurance is keeping these companies profitable right now,
Mm,
because Medicare and Medicaid are extremely disrupted right now due to a
mhm,
number of things, including Trump administration policies.
mhm,
Um, so, if employers continue being as dissatisfied as they are, as we've talked about for more than a half hour, they're going to be in trouble. So I
mhm,
guess it's kind of up to them, if they're going to be proactive, then there's some opportunity for whoever is
mm,
forward thinking, strategic, and,
mm.
willing to work with other stakeholders.
Don't let a good crisis go to waste.
That's right.
If there's going to be a crisis, let's do something cool and interesting. Well, where can
Absolutely.
people find you? We want to stay tuned into what's happening in the health plan world, right?
Yeah.
Where should
Yeah.
we go?
Feel free to follow me here on LinkedIn, Peter Johnson. And then, I write at FT Healthcare Specialists, all the news you need about health plans and health benefits.
So great. Well, thank you so much. I look forward to connecting 5 years from now, hopefully sooner, but
Yes,
just to see what of our predictions might have come true and if things have really changed. And it's always possible, you guys. Come on, health plans, come with
do
us.
it. Do it, guys. We need a hero.
Come, a hero. Yes, please, somebody. This is fantastic. Well, thank you so much, Peter. I really appreciate the conversation today and for your reporting and your focus on this sector that is very complicated.
Yeah, thanks for having me. It's great to be able to talk about this stuff holistically. And, yeah, thanks for the opportunity.